We see one person a day die of an overdose death in Ireland each year. And those statistics are pretty steady in the data. So we know that families, individuals, families and communities are massively impacted upon by the drug problem, and criminalising drug possession simply hasn't helped. It hasn't worked, and we want to see things change. Yeah, so the Safer from Harm campaign is the campaign to decriminalise drugs for personal use, which essentially is we want to see a health-led approach to drug use in Ireland rather than the criminal justice approach. The possession of drugs for personal use has been illegal in Ireland for over 40 years now, since 1977. Prohibition itself has failed, and that's been acknowledged in loads of reports and data. We want to see a more nuanced response, a cleverer response to the issue of possession of drugs for personal use. Over the last 40 years, we have seen more people taking drugs, okay? We have seen drugs become more potent, and they are cheaper. So there is far more harms associated with drugs. I don't think anyone is surprised by what I'm saying. Now, during the summer, this summer, government has announced a new policy, but that policy hasn't gone far enough. And it's a compromised policy. So if you get caught in possession of drugs, the guards will send you for a mandatory health referral to the HSC, and you will be assessed as to whether you are, I suppose, a non-problematic drug user or a problematic drug user. But then the next time, if you got caught again, you would be dealt with under the adult caution scheme. And then if you get caught again, you go to court, okay? And certainly my understanding is that the previous times that the supports that you've had and the adult caution you had will be taken into account at court. That's okay if you can comply with the first chance, essentially. So if you're told, you're going for a mandatory referral for your health assessment, you've had your drugs taken off of you, you've been told it's unacceptable to be in possession of drugs, under the law it is, okay? So now if you can comply with that first chance, all well and good. You have no criminal record, okay? But what about people who have problems with drugs? What about people who can't comply with that first chance? The people who have a chronic and relapsing condition, some people refer to it as dependency, some people refer to it as addiction, but nonetheless, if you can't comply with that first chance, you are going to go down the criminal justice route. And essentially what that means is the most vulnerable of our society, who, with regards to drugs, are still going to go down the criminal justice route. And that is not a health-led response to drugs, okay? So we want to see people given every opportunity. If it is a health-led response the first time, then it must be a health-led response the 100th time, because they are the people who need support. We should not be punishing people, we should be supporting people. And why is that important? Because that means that people can come forward. The stigma and shame attached to problematic drug use or alcohol use is a barrier to getting help. And I think people know that. I think people, if you've had a family member with a drug problem or an alcohol problem, you know that, even thinking about whether someone with one of your family members who might have a drug problem being caught by the police in possession, oh my God, that's going to make things worse, right? It's bad enough that we're trying to cope in this situation where our loved one is struggling with a drug problem. It's even worse to think they might actually go up to a prison. So, it's scary, and it means that the person themselves can't come forward and talk to you as a family member or friends or whatever, or a professional, their GP or addiction worker. So it just stops people coming forward. And I think that whilst people might not put as much value on it as they perhaps should, removing stigma and shame is a major benefit of having a decriminalised health-led response to the possession of drugs for personal use. It will, with time, help us, just improve our situation in Ireland, So it doesn't happen overnight, but we know that we've got into this awful mess with our drug use under prohibition. So we know that if we change policy, that and particularly around decriminalisation, that we will, in 10 to 15 years' time and 20 to 30 years' time, we will see significant changes in how we're all responding to the issue of drug use. And we will look back at this time and say, that was really important what we did or didn't do. So that's why we need to push for a really meaningful health-led response to the issue of drug use and drug possession particularly. I'm really proud to live in Ireland at this current time in a world where there's a lot of intolerance, politically and such, in other jurisdictions. And yet in Ireland, we are progressive, we are compassionate, we are accepting, and we can all be enormously proud of that. I think that we do need to go further in certain policy areas, and one of those areas is the issue of drugs. And I think that if we really push now for an effective health-led response to the possession of drugs for personal use in the current environment, we're pushing an open door. People will respond well to that. The message will be clear that drug use is risky. It's safer not to use drugs at all. But if you do use drugs, we want to look after you. We want to make sure you're safe. And ultimately, if you have a drug problem, we want to support you and give you every opportunity to make healthier choices.